morning. So I'm gonna perform an easy pap. So first and foremost, always make sure we check the patient's chart. So once inside, we always have to wash our hands first, and then we always introduce ourselves to the patient, explain to them the therapy, such as telling them that this is what we call an easy pap. This is it was part of an airway clearance, would help you clear up your airways, remove any secretions, and this would also reduce any collapse of your lungs or prevent any collapse to your lungs. So first is we always do our vital signs assessment of the patient, make sure we check the ID band, and also to ensure that they're the correct patient. And then after that, make sure we inspect the device for any cracks present. If it does, make sure we replace it with a new one. So with this device, initially we start it up with a pressure monitoring port such as this one. We insert it directly in here, and then the other port is for the oxygen source. Make sure when inserting both of them are secured and tight. And then when setting this one up, initially we start it up at about 5 liters for the initial setting. So another thing is when doing it is make sure we demonstrate in front of the patient, so for them to understand. So with this is make sure that the patient will take a good seal on it when using a mouthpiece, and then it should be positioned like this, not on a downward. And then make sure that you do let the patient take a slow deep inspiration and allow them to take a strong cough or exhalation, not to do in a forceful way. And when holding this one up, they should not obstruct on the back because it might affect the flow on it. And then when using a mouthpiece, make sure we also have an option of mask just to make sure that the patient will be able to tolerate. If they are not able to tolerate the mouthpiece, make sure you have a mask in place. And then ideally, when using this, we always do it about 3 to not more than 5 times to prevent the patient to have any complications. And during therapy, let the patient rest between breaths, and then allow the patient to cough so that they able to expectorate. We have a basin in place or a specimen cup to obtain any specimen. And if the patient does complain any dizziness or lightheadedness, please terminate immediately the therapy to prevent any complications. So assuming we started up like this, so we gonna hear a noise, so if we've stuck it, it's gonna affect the flow. So now we're gonna take this to the patient, let the patient take a slow deep inspiration, and let them take a strong, not a strong, forceful way, but a strong exhalation. So another thing is, because this monitoring port is disposable, we can also use it without it, but make sure we cover this one up to prevent this hole or port from exposure to ambient air. And also with this device, the EasyPap would also benefit to some patients if they use it together with a nebulization treatment, with using a T adapter in front with a specimen of the medication cup, because using together with a nebulization treatment, it would help restore and improve their lung volumes. So once everything is done, turn this one off. With this device, they should not soak it in water, allow it to air dry, with the mouthpiece only to be sterile, clean in sterile water. So once everything is done, make sure you put it up in a clean container, reassess the patient, make sure you position them up from upright position, do another set of vital signs. Once outside, wash our hands first, and then make sure we chart everything, communicate with the staff or nurse in charge. Make sure we also chart it, including with the pressure monitoring, if how much the patient was able to reach with this white piston. And if the physician is present, that would be great. Try to communicate with them, and we're good.